I'm assessing P-to-A distortion. I'm going to close one of my eyes and put my thumb at the level of S2. I'm looking for lateral sway greater than a quarter inch. Can I get you, if there is sway greater than a quarter inch, then it's a category 2. Can I get you to turn to the side? Okay, now I'm going to put my thumb at the level of the acromion, and I'm looking for sway anterior, posterior. If the sway is greater than a quarter inch, then it is a category 1. If there's no sway, it's a category 3. Okay, I'm going to assess the first rib. Alright, can I get you to flex your neck? And come back up. Flex again. And come back up. Okay, thank you. So if there's bilateral movement greater than a fourth of an inch, it would be a category 1. If there was unilateral movement greater than a quarter inch, it would be a category 2. If there was no movement, it would be a category 3. Okay, so now I'm doing cervical indicator. I'm going to feel for each cervical spinous. And if I feel something in there, then it's related to lumbar TVP inferiority on that side. Then I'm going to move out and feel the cervical TVPs. And then if I feel something over there, it will relate to the lumbar spinous rotation on that side. So if I felt something at C1, it would relate to L5. At C2, it would relate to L4. At C3, it would relate to L3. At C4, it would relate to L2. At C5, it relates to L1. At C6, it relates to T12, and C7, it relates to T11. Okay, so I'm doing cervical compaction. I'm going to lift the patient's head, have her hands on her stomach, and lift her feet up 18 to 24 inches. Okay, thank you. Now I'm going to press in the sagittal suture the best way I can. And press down and lift the patient's head up. And I want you to try to lift your feet again 18 to 24 inches. Okay. So then I would see if which one was better or worse. If it was better with compaction, then I would continue on with the cervical step to see where the restrictions were. So then I'll go up first to level 1, and that assesses T1 and C7. I would also, if it's restricted in this area, I would also look at the dorsals from T1 to T4 to see if there's any subluxation there. Then I move up to the second area, which is C6 to C5, and then up to the third, which is C4 to C3, and then the fourth section is C2 to C1. If any area was restricted, I would do a figure 8 motion in this way. Okay, I'm doing basic 1, category 3. I'm going to have all 4 of these fingers on the EOP and lateral 2 along the nuchal line. I'm going to wait for it to balance out and the CSF flow to be balanced. Then I'm going to go and palpate around the sagittal suture, feeling for any tenderness. Ow. Okay, then I'm going to cross my fingers over here and contact here. And then I'm going to have the patient take a deep breath while pushing laterally line of drive to separate the parietal bones and lift them. And then I'll do that 3 times. Okay, so I'm testing for psoas category 1 and 3. I'm going to make sure that my patient is de-artifacted of all watches and any belts. I'm going to grab the arms in traction up, bringing the hands into a prayer pose, and then bringing them down here so I can see which one is shorter. It looks like it's the left side, right side. Okay, you relax your hands. So what I'm going to have to do is have the patient lift their leg and bring it out into a figure 4. I'm going to contact just medial to the ASIS with the palm of my hand, and then push it out as they inhale and come back. Okay. Then what I'm going to do is keep your leg up for category 2. That was category 1 and 3. For category 2, it's okay if I go between your legs. Stabilize here. Contacting just medial to the ASIS and pushing down. Take a deep breath and exhale. and then I would reassess their arms to see if they were even. Okay, I'm doing the anterior inferior femoral ligament test. I'm going to bilaterally internally rotate the feet to see which one is more restricted. It seems to be that the left foot is more restricted. So I'm going to come over on this side, on the opposite side. I'm going to contact the femoral head and then go slightly superior and posterior, and I'm going to pull up. I want you to rotate your foot inward, your left foot inward, okay? And then as I pull up, I want you to bring your foot out, okay? All right, you ready? Bring it out. Okay, go back again and bring it out. Okay, and then on this third time, I'm going to do it really fast on the count of 3. I want you to bring your foot outward very quickly, okay? 1, 2, 3. Okay, now I'm doing the arm fossa. Make sure that my patient is de-artifacted from all watches and belts. I'm going to have the patient lift their arm up at 90 degrees with a soft fist, okay? And I would like for you to contact your pubic bone, please. Okay? And then I'm going to use a flat 4 fingers here, contacting around the inguinal ligament. I'm going to start with the superior fossa. You remove your hand. And then I want you to resist when I say resist. And I'm going to push down and pull at the same time. Resist. Okay? Then I'm going to go down to the superior fossa and do the same thing. Push down and resist. Okay? And I would do this bilaterally. You can put your arm down. Going in a clockwise direction around the patient's head. If it's not a grade 5, it is considered a category 2. So anything below a category, anything below a grade 5 is a category 2.